Well, it was when I'm trying to think, I had my upper bleph first, which was the upper eyelid surgery. And I was in my, I'd say, mid 40s at that time. And I came into Dr. Mendelsohn's office because I had several friends that came here. And I met with him and with his patient coordinator. And he put me right at ease. Um, he used a mirror and he actually lifted up my eyelids and showed me what just even a simple eyelid lift would do for me. Um, he told me how easy the procedure was, that I wouldn't need anesthesia, that I would literally just be given a topical anesthetic and I wouldn't feel anything, and convinced me how easy the procedure was because I was a big chicken. I was a little leery of the whole thing. But anyway, literally, when he held up the mirror and just tightened up my eyelid and showed me what the effect was, right then I think I was sold. So I had the upper bleph first. It was pretty easy. I think they gave me a Darvon or something to relax me. And I remember he asked me what CD I wanted. I wanted John Mayer, and he put in a John Mayer CD and put the lidocaine or whatever in there. And literally it was 20 minutes total. I think 10 minutes I didn't feel a thing. And I'm a big baby. So the fact that I could do this and, it was a breeze. Then the recovery, you have to keep ice water, gauze pads dipped in ice water on it for the first day. But it's not that bad. I had some bruising. I would say I wore sunglasses for maybe a week because I was self-conscious. But then I think the sutures come out after a week or 10 days. Then you look pretty darn good. And I have eyelids again. I can wear makeup. It's not crepey. It was wonderful. I don't think anyone could really tell I had surgery. That's the beauty of it. It wasn't so drastic that I looked artificial. They just thought that I looked rested. Rested was the word everyone looked. You look so rested and refreshed. So the fact that it didn't look too tight or artificial, sometimes like the celebrities that you see on TV, and it looked very natural. But yeah, the biggest thing I got was rested and refreshed. My husband always thinks I look good, so that's a hard question for me. But I think we look the same age. The other day, someone actually asked me if I was young. They thought I was younger because he's 6 years younger. So I think we definitely look the same age now, which was important to me. Then what happened, the catalyst for the whole Dodd procedure was my high school was having a 50th birthday party celebration just to celebrate the fact that we were all turning 50. And I had toyed around with the idea of a chemical peel because I know they're very effective and I've talked to people that have had them done. But Dr. Mendelsohn was very honest with me that you may need to lay low and stay in your house for 10 days or so because there's a lot of peeling and sloughing going on. So can you afford to be at home for 10 days and not out meeting with clients? I'm self-employed, so I need to be out and about a lot. And I don't really have a 10-day period of time where I'm not at my son's high school or at a lacrosse game or meeting with clients that I can hide. So I started reading about the Dodd procedure online and educating myself. And I know that Dr. Mendelsohn, I believe, was the first in Cincinnati to get this procedure, so the equipment. So I talked to him a bit about it, and I think I was one of the first to have it done. And he told me that it wouldn't be that painful. Again, local topical anesthesia, they just put, or topical anesthetic rather, they just put this cream on my face to numb it for about half hour to 45 minutes beforehand. And it feels like, I don't know how to explain it, like a little bit of static electricity, I guess, going across your face. It's a little bit warm, but not totally uncomfortable. And they just wave this wand, I guess it is, over your face. And at first I was just going to do specific areas, and then he said, why don't we just do your whole entire face? I was just going to try to get rid of the age spots, but they ended up doing my whole entire face.
So, forehead?
Forehead, I don't think they did my neck. They just did my whole entire exposed face here. And I'd say I hit out, well, you're not supposed to go in the sun right away, so for sure I stayed out of the sun for a couple days. And I think for about a week, it was red and a little bit peely, but it wasn't drastic. I didn't have to stay stay in the house. I remember going to a lacrosse game, and Dr. Mendelsohn said just wear a big hat and sunglasses to protect your skin, which I did. And then The biggest thing I've done since the dot procedure is I've gotten into the habit of protecting my skin so that I don't have to have it done again. So now that I've gotten rid of the sun damage and the fine lines, I've started using a total physical block on my face. When I go outside, I have a convertible. So I'm very conscious about protecting my skin to keep it from getting distressed and the age spots from recurring. And I also use a Retin-A every night on my face, a 1% Retin-A, and I use a 20% vitamin C every day, because I think once you have the procedure done, it's important to maintain your skin and keep it looking the way it was after the procedure. I work in the field of public relations. I'm a self-employed public relations consultant, so it's very important for me to look my best when I'm out in the public, dealing with the media and my clients, whether I'm in meetings or helping to prepare someone for an interview. I always have to look the part and look my best. So I feel that this has really helped me look my absolute best and have a refreshed look and great outward appearance for my clients. I always have to be very positive in my job and very upbeat, and I think just because I feel better about how I look, it makes me more positive with my clients. Yeah, and I've always taken great care of my body. I work out every day. I do Pilates, yoga, spinning, weightlifting, a lot of walking. I'm kind of obsessive about my workout routine, so I've always made it a point of staying fit and trim, which is harder to do when you're in your 50s. But I felt I was at the point in my life where my body looked good and taut, but my face didn't match. My face looked saggy and had age spots and wrinkles, so I wanted my face to match my body. So I think this has really helped because my skin is now tight and a lot of elasticity in it. The spots and fine lines and wrinkles are gone, so I feel like they totally match in every way now.
Okay.
My high school has decided to have a reunion again next year in 2013, and I'm on the committee. So I absolutely know that I'll be looking my best this time because I've had my dot procedure and my upper bleph, and I will be looking refreshed and young, and I'm on the committee this time as well. And what I noticed at my last reunion is that the women had aged pretty well because I think we all have some sort of Botox or procedures done, but the men don't look so hot, so I think they need to start taking advantage and having a little bit of Botox too. The men don't age as gracefully, and I think a lot of the men had thinning hair. They actually need to be thinking about getting some hair replacement going too. Now that I've fixed my skin and I have it looking the way I want it to look after having the dot procedure, I think the most important thing I've learned is that you need to continue taking care of your skin. So, I invested in this procedure. I feel that my skin looks its best. I don't want to have age spots and wrinkles again. So I've made it a point. I use a total physical block on my face every time I go out in the sun, and I drive a convertible. So it's very important. It still lets you get color without letting in the harmful rays, so you're not going to be pale. I also use a 1% Retin-A every night on my face, and I use a 20% vitamin C oil during the day on my face because Dr. Mendelsohn's staff has assured me if I continue maintaining my skin with these products, it'll continue to look good. I don't want to have the procedure again. I want to just keep my skin looking the way it does now. A lot of the drastic measures. When I started to turn 50 is when I really realized the huge difference. And then this is actually my wedding photo in Jamaica. We got married on the beach. So this was over 6 years ago. I love that photo. They framed the palm trees like a heart around us. Oh, that was such a happy, carefree day. Just the two of us in Jamaica for a whole week.
Okay.
Then this is a photo that was taken when, right after I got married. I nominated my husband for one of the hottest husbands in America in the Red Book magazine contest without telling him. And he ended up being one of the 5 hottest husbands in America. He wasn't one of the winners because he wouldn't let me tell anyone about it so they could vote because he was so embarrassed. But he still made it to the top 5. And this was the picture that the Cincinnati Enquirer ran of us after it was announced that he was one of the 5 hottest husbands in America. He was really embarrassed about it. I keep this picture of the living room.